About 2 years before opening, we began to really put a lot of emphasis on getting our demographics right, trying to forecast demand, trying to get financial projections, which would include things like our payer mix and demographics. We really wanted to understand what it was going to look like. But it took a lot of effort and a lot of planning, both from the local hospital, but in particular from our division office, to understand what was happening in the market at large. What was interesting about this project was because we were starting from scratch, we weren't providing pediatric care at any of our facilities. We were especially dependent on others for the physician collaboration and for the clinical expertise. We spent a lot of time talking to doctors who were already practicing at the Children's Hospital that's here in Austin. And I think the fact that that's baked into our identity really made this project hum. We were able to combine a lot of market intelligence, what I'd call quantitative data about the number of admissions, the number of visits that we would expect. We even broke that data down to visits by certain specialty, what would be cardiology, what would be orthopedics. So we had what I'd describe as some hard numbers that we felt like were pretty reliable. But there was also a lot of qualitative data, just based on conversations that we had with parents, but also we formed an advisory group of community pediatricians, and they weren't giving us the same sort of specificity, but there was the general sense, the gestalt from those conversations was that the community was very eager to have a children's hospital in this part of town and a children's hospital affiliated with St. David's HealthCare, and that they would support it. That was not reflected in the quantitative data, but was very important for us to validate the strategy that we were pursuing. We heard from those families repeatedly. We have NICU reunions. We have all sorts of follow-up that we do with those patients. We heard their voices loud and clear that they wanted to be able to bring those babies back here. It felt like their medical home where they wanted to be. We created an advisory group of families, and we came down and asked them, help us design the right kind of patient care environment. One of the things the parents told us was they wanted an environment for their children that was inviting and felt safe and was appropriate. And I think you can tell by looking behind me, we really listened to their feedback, and we're very proud of the way that this area turned out. And we had very clear communication with payers who expressed to us their desire to have St. David's create a narrow network model, but because of the fact that we couldn't provide care for pediatric patients, we were excluded from a number of narrow networks. So all of those stakeholders had something to say to us that drove us in this direction. Because St. David's HealthCare is a partnership, we really have a two-tiered approval system for allocating capital. The first gate that we have to clear is to be involved on big projects, more than $5 million, with CAMS, which is a program through HCA, our large for-profit hospital partner. And so HCA provides a lot of logistical support as well as financial modeling and forecasting through the CAMS process, and we go through and create a CAMS package that requires approval from everyone on HCA's side of the table to validate that the assumptions and the costs that are built in there are reliable and you can depend upon them. And then we take that CAMS package and we present it to the St. David's HealthCare Board of Governors. First it goes to the Finance Committee of the board and then to the overall board. And that board reviews those packages and makes sure that they can confirm it's meeting the needs of the community here, it's consistent with our vision and our values, and that they believe the assumptions and the projections that were made in it. So the planning process for us included the physical infrastructure, but probably more important than that was the human component to this, the staffing component. So we began to develop a gap analysis around the types of personnel, the types of employees that we were going to need, and whether or not they had the capabilities to provide care that we needed to these patients. We knew, for example, that we didn't have pediatric nurses, but we do have a lot of respiratory therapists because we have a big NICU, and so we had to determine what staff are we going to need to hire and what staff are we going to need to train. A lot of that, of course, was driven by the volume forecasts and the demographic quantitative analysis that we had done and an understanding of what we thought our patient volumes would be. In its first 4 months, the St. David's Children's Hospital has far exceeded all of our expectations for volume and for patient experience. We couldn't be more pleased with the start of our new program.